Hi, I'm Dr. Rajdeep More, gastroenterologist, hepatologist and GI endoscopist at Gastrocure Endoscopy Center and Liver Care Clinic in Thane. Today we'll be talking about a specialized test called as esophageal manometry. Now what exactly is esophageal manometry? So manometry entails the measurement of the pressures in the esophagus. Now why is it important? So as you understand, this is the food pipe, this is the stomach. So once the food bolus is swallowed, it is pushed down by the esophagus into the stomach. Now there are various reasons why, or various conditions in which the movement of the food pipe may not be normal. This can lead to a variety of problems. So what are the indications of esophageal manometry? So indications, so what are the symptoms in which we do manometry is when there is a non-cardiac or an atypical chest pain, where after you swallow food, you classically have a lot of chest pain and you have got yourself evaluated from the cardiac point of view. You've ruled out that there is no underlying heart condition which is causing this chest pain. So whenever the movement of the food pipe or the esophagus is not normal, this can lead to the similar chest pain, which can be diagnosed by a manometry and in which you have already done an endoscopy and it is normal. The other things is, if you want to proceed with a surgery like fundoplication, before that a manometry is important for diagnosing conditions like hiatus hernia or reflux disease. And another cause is dysphagia. Now what is dysphagia? That is difficulty in swallowing or painful swallowing, odynophagia, where the food bolus, once it is swallowed, is stuck in the food pipe and it is not going down. So you have done the endoscopy and there is no other reason why it is not going down. So in those conditions we have to do an endoscopy, esophageal manometry, where we measure the pressure and we see that the food pipe is moving properly or not. The pressures are whether they are too high, which prevent the food bolus from going down and it keeps the food pipe closed. So in a manometry, a catheter is inserted through the nose. After applying local anesthetic, it is placed in the lower part of the food pipe and the patient is asked to swallow sips of water. When the swallowed sips of water are seen through the food pipe, they pass through this catheter and the pressure recordings are done on a computer. Based on that, we can diagnose a lot of conditions such as achalasia cardia, where there is a tight lower esophageal sphincter. We can also diagnose conditions like esophageal spasm. We can also know whether the lower esophageal sphincter is widely open and causing reflux. So these are all the conditions that we understand from manometry. The manometry classically takes about 15 to 20 minutes to be done. It has to be done in fasting. It is done in an awake state without the use of general anesthesia. Only a local anesthetic throat spray and lignocaine throat spray is applied prior to the procedure. It is a very comfortable procedure and it is an essential diagnostic tool whenever you have not reached to a diagnosis in spite of doing endoscopy. So visit your gastroenterologist at the earliest if you are having problems of the esophagus to understand more about esophageal manometry and also in conditions such as hiatus hernia or reflux diseases.